look at how all of this came into being, information technology has been rising since the 1960s, but with the American Recovery and Reinvestment Act, it really actually made it mandatory to get EMR and EHR with physicians. And that really pushed into this entire sector that has just been growing like anything. And when I started to dig in and went to the HIMSS conference, which I don't know if you guys know, but it's like the largest conference for health information technology. I went last month. There's 640 corporations that were present. Corporations that have never had anything to do with healthcare but are now there, Oracle, Cisco, and whatnot. And it astounded me. And also at this conference, there was a lot of discussion and banners everywhere about curing disease, improving healthcare, that with really no physician or clinician presence. And there's a great belief out there that information technology is going to improve outcomes in healthcare, as we see with MACRA, measurable objectives. And I think it really starts with people who get involved with the industry who just don't know what they don't know. And much of that is also because of the absence of physicians. That our profession makes us the stewards of what we do in practice. And we heard that today by the stories out in Missouri. And I think that we, perhaps by being busy, maybe because in our own training haven't had advocacy as part of our curriculum, because maybe perhaps we're a profession and we see ourselves not advocating for ourselves as a bad thing, but we have been left out of the conversation. And what I find in all these forums is that we're reacting to that which has all happened. And so this is all kind of came about because I saw that this horse is really out of the barn. I mean, it's gone. And I think right now what I was trying to think of and consider is that we really need to be proactive about things that are already occurring, and they're occurring at a really quick and fast rate. So health information technology really encompasses not just EMR and EHR, as we all know. It doesn't just cover quality care payments and alternative payment models and MACRA. It also encompasses precision medicine, which I think actually is one good part to it, is that the NIH defines that as having care that is individualized with an ear towards genetics, lifestyle, environmental issues, and I think that can certainly lead to better things. We had a great speaker last year, exactly a year ago, at our Physicians Council, who spoke about targeted breast cancer treatments. It made sense. That's the kind of scientific innovation I think we're all for. However, much of the other stuff in information technology can be very concerning. The most interesting was artificial intelligence and machine learning, which I will get into in a minute. And then the fourth pillar that I found that was really huge was, as a result of all the data collection and big data, cybersecurity, of course, has become a bigger issue because of the protected health information. So this is a huge growing industry that it has, for example, Google had, I think just a couple years ago, no starter projects involving AI, but now has 2,700 as an example. Next slide, please. Thank you. So we were talking about unfunded mandates that have resulted in unintended consequences or maybe intended consequences. The mandate for EMR, once again, was definitively started in this last presidential administration, but there was a movement that started sooner than that at Stanford.